Ready? Go. Alright. Hi, my name is Emily Conover, and I'm going to be doing a presentation about the different types of stress. Now, there are 3 types of stress. There is acute stress, episodic acute stress, and chronic stress. Now, the first type of stress is a common form of stress that everybody experiences, and it's called acute stress. Acute stress is a psychological condition in a response to traumatic events. Now, you can experience it by witnessing a traumatic event, or it can be something as simple as meeting a deadline at school or a job. At Louisiana State University, a student and a professor conducted a research that showed a single exposure to acute stress affected the information processing in the cerebellum. And this is the cerebellum right here. It's the back of your brain. And whenever that's affected, it triggers emotional distress, muscular distress, and hyperarousal. Now, with emotional distress, it triggers things like anger, irritability, anxiety, and even depression. With muscular distress, it causes muscle tension in common spots like your neck, your jaw, your shoulders, and your back. And in hyperarousal, that affects your blood pressure. It increases your blood pressure. It gives you rapid heart rate, heart palpitations, dizziness, headaches, and stuff like that. Now, when you experience frequent amount of acute stress, it leads to our second type, which is episodic acute stress. Now, there are 2 cardiologists who did a research and theorized that there are 2 personality characteristics that coincide with episodic acute stress. The first one is type A. Now, with type A, the characteristics are impatient, aggressive, and hostile. And whenever you have those traits, you develop, you're more prone to coronary heart disease. Now, the second one is called worry-wart. Now, in the 1950s, there was a cartoon about a character who always worried a lot. So this is where it basically came from. Now, with worry-wart, you're basically think of negative outcomes with everything. There's nothing positive, and you expect that the world is a dangerous place. Along with episodic acute stress, it has the same symptoms as acute stress, except it has the cognitive distress. You get immune system deficiency, heart disease, and irritable bowel syndrome. This leads to our third and most severe type of stress, which is chronic stress. And this is caused by, it can be anything from family, an unhappy marriage, unemployment, substance abuse, stuff like that. And with this, it has the same symptoms of acute stress, episodic acute stress, and it actually leads to more violent behavior like suicide. You can get heart attacks, strokes, develop psychosis. You can have a physical and mental breakdown, and have violence as well. Yeah. According to the American Heart Association, it does increase your high blood pressure, which is a known fact to develop coronary heart disease. And when you develop coronary heart disease, it can actually kill you. Now, if these things are left untreated, it can eventually take off years of your life, and it's, obviously stress can kill you. It can literally kill you. Stress is a reactive mode and gets triggered by many things in life, or things called stressors. And with that, hopefully we can take necessary measures and appropriate ways to relieve stress, like coping methods such as breathing techniques, exercising, things that can release that adrenaline that fills your brain with cortisol. Oh, and that is the end of my presentation. So that is a few things that you need to learn about all 3 of those stress.
Yay. You didn't press play on the phone.
You're lying.
No, I'm playing.